Across the country, hospitals say they are under overwhelming strain. Respiratory illnesses are spiking ahead of the holidays. It's forced some hospitals to postpone surgeries to free up space. Quebec's health minister is even telling residents to stay away from emergency rooms if they can, as ER doctors say the situation is now out of control. Dr. Kathleen Ross is the president of the Canadian Medical Association. She joins me now to discuss Canada's healthcare crisis. Doctor, welcome to the show.
Thank you. Happy to be here.
Happy to have you. The government, as you know, announced a landmark healthcare funding deal earlier this year. They pumped about $2 billion into the Canada Health Transfer. There have been some other spending increases. Has that funding boost made a difference to the system? Have you noticed it?
So these are challenging times for certain. With over 6 million people not having access to primary care, surgical backlogs, emergency departments that are overrun, and certainly we know that we need additional cash and resources into the system to make it work. So 200 billion over 10 years is a tremendous commitment for certain. But I also want to focus in on that 25 billion for those tailored bilateral agreements that allow individual provinces and jurisdictions to tailor those additional funding to meeting the challenges that we face. And only two provinces to date have actually signed on for those. And those key areas of focus across the country are access to family health teams, to supporting healthcare workers and reducing backlogs, increasing access to mental health and substance use, and of course, modernizing our healthcare system, improve how we collect data, not just on healthcare delivery, but who's doing healthcare, where, how, and where do we have gaps that we need to address.
I mentioned that $2 billion, that one-time boost, that was really intended to clear backlogs, to improve wait times, the things you just mentioned there. But the Fraser Institute, they recently released their annual review, and they found that wait times are the longest they've ever been. The median wait time is now nearly 28 weeks from a GP referral to treatment. What do you make of those figures?
So there's no question that we have to look at the whole system to solve our current crisis. That commitment for funding is very necessary, but we need to look at how we are delivering services, who's delivering services, and ensure that we have enough healthcare workers to actually deliver with those resources. At the moment, we are struggling to meet our human health resources across Canada, and it's time to modernize how we deliver care and think outside the box to improve access for Canadians.
Yeah, on staffing, I mean, there's been huge population growth in this country over the last year. We've added about 1.3 million people to the population. And when I look at the number of residency spots, so the number of doctors that were graduating into the system, that number's been stagnant. In 2018, we had 3,300 first-year residents. In 2023, we had 3,500. We've added 4 million people in that 5-year span. Are we really graduating enough doctors? Are there enough people to take care of all these new folks that live here?
So it really is a triple challenge that we face. We do need to increase the number of people that we're training in Canada across the board when it comes to healthcare workers, no question. We need to work very hard on retaining the workers that we have in the system. Because unfortunately, we're burning out in large numbers, largest numbers of early retirements and people leaving the profession altogether than we have ever seen. But that's critically important. And then we do need to have a way to streamline internationally trained healthcare workers that are already in Canada or wanting to come to Canada, so that we can incorporate them into our workforce. We do need to really increase the number of people delivering services and change how we're delivering those services so we can be the most effective.
Would the CMA support allowing more international medical graduates into the residency system? Because that seems to be a major roadblock right now. A lot of folks, many of them Canadian born, have gone to school overseas. They want to come home and practice, and they face a lot of red tape when they try and get a residency position to launch their career. Would the CMA support allowing more of those folks into a residency?
So the CMA has absolutely supported the incorporation of internationally trained healthcare professionals. We saw in the federal government's commitment to funding this year, $500,000 to increase those practice-ready assessment positions that streamline clinicians in the most efficient fashion, but actually to have a hard look at what are the roadblocks and barriers and try and streamline those processes. And this is no small undertaking, but I think it's beginning to move.
You mentioned 6.5 million Canadians do not have access to primary care. That is, to me, an eye-popping figure. That is a lot. I mean, your home province of British Columbia, nearly 1 million people don't have access to a family doctor. Can we really say we have a universal and accessible healthcare system if so many people don't have regular access to a family doctor?
I think that's an absolute fair point. So, looking at primary care, and as a family physician myself, I feel this very dearly. Primary care is the foundation of our healthcare system. It is the front door where people turn to for care. And if we don't have that connection to those long term relationship based care, we know that our outcomes are not as good. We see people coming into the emergency departments to access primary care because they have nowhere else to go. This is absolutely a priority. We also know it takes a long time to train primary care providers, both family physicians and nurse practitioners. So we need to find a way to wrap teams around our primary care providers so that we can deliver services to Canadians in a broader sense. So reimagining what that primary care foundation looks like.
You mentioned cash off the top. I know it's not always about money, but money certainly helps when we're talking about healthcare. The government's about to spend $13 billion on dental care over the next 5 years. Do you support that program, or do you think that money should have been used to prop up our existing healthcare system?
I think we need to take a broader scope view of what is health. Health isn't just about the services that I provide. It's not just about the medications that I prescribe, but taking that broader sense. Dental health is important, and there are many disease processes, unfortunately, that come from poor dental health. So that's part of it. Looking at social determinants of health, housing, food security, education, employment. These are all other things that Canada needs to take a hard look at if we're going to improve the health of Canadians.
But I've heard some criticism that maybe now is not the time to stand up dental care, and they're talking about a new pharmacare program in the new year. Maybe it's time not to stand up new programs, but to invest in the system we already have. There's already a system on the ropes. There's already a major crisis in the public Medicare system we have. We shouldn't really branch out and try and stand up some new programs. Do you share that view?
So, the healthcare system that we have currently is not delivering the services that Canadians need. Not to say that there are not pockets of excellent work going on across the country, but we don't have a system that is delivering. We need to start thinking in a broader sense and modernize how we deliver healthcare for Canadians.
I spoke to your predecessor at the end of 2022. He said at the time that the healthcare system was facing a collapse. He was really quite worried about the state of affairs. Do you feel more hopeful about the healthcare system than he did at this time last year?
So I feel hopeful this year only because we have seen cross jurisdictional commitment to improving healthcare. This is the first time we've seen provincial, territorial, and federal government representation all speaking the same language and all driving towards the same end goals. I recognize that's not going to happen overnight, but that commitment is immensely powerful.
All right, let's leave it there. Thank you. Dr. Kathleen Ross is the president of the Canadian Medical Association. Appreciate your time.
Thank you very much.
Dr. Judy Morris is the president of the Association of Emergency Physicians of Quebec. Dr. Morris, welcome to the show.
You're welcome.
Dr. Morris, how would you describe the current state of affairs in Quebec's emergency rooms?
Things are probably as bad as they've ever been, and throughout many areas of the province. We see crowding, occupancy rates that we've never seen before. We see rates of 200 and above on a regular basis in a lot of emergency rooms. Longer wait times to being seen by doctors, and it's really concerning because we know it's tied to diminished quality of care, and when we look at data and studies on the matter.
So many of the hospitals, as you say, well over capacity. What's contributing to all this? Why are we seeing a surge in patients at the ER?
Well, our network, our emergency rooms have always been fragile. I've always seen crowding pretty much every year when we would have influenza waves pre-COVID. And in the past 2 years, we've lost healthcare personnel throughout the healthcare network. And this has diminished our capacity to take care of all patients coming in. And what happens why we talk a lot about the emergency rooms is that when there's no capacity in hospital beds and long-term care beds, well, people kind of stay stuck in the emergency room on the stretcher side, and it causes disproportionate pressure on ED teams across the province and across the country. Frankly, we're seeing that elsewhere as well.
Yeah, when people don't have access to primary care, they come to the ER, right? I was looking at some stats today. 1.2 million Quebecers do not have a family doctor. They don't have access to primary care, so they're coming to see you in the emergency room. Surely that's a big part of the problem as well.
That's one part of the problem, and in Quebec, they have tried to address this by creating a phone line, by creating access in clinics, even for the patients who didn't have primary care access. But it really affects more the kind of the waiting room, the minor care area of the emergency room. What we're seeing right now, on what my colleagues, have done, kind of raising the flag on the issue, is the stretcher side is also suffering a lot, and this is because we lack long-term care, home care services, mental health resources, and hospital bed capacity, and also just a lack of general hospital flow and efficiency throughout the system.
The health minister of your province said today that the best thing they can do right now really is just have people avoid going to the emergency rooms altogether, and he's urging folks to get vaccinated for COVID and influenza. What do you make of that advice?
This is a last minute resort, kind of, we're stuck, please help us out. And again, it's going to affect mostly, and it's the ones that are well, it's going to affect mostly the wait times in the waiting room. But the stretcher side, well, the vaccination and try to prevent spreading the disease might help us, because what we see on the stretcher side of the emergency room is the more vulnerable population, the elderly, the patients with chronic disease that do get COVID and do have to spend sometimes a few days in the hospital. So this is going to, be of less help. Try to avoid the ER for that other part of the problem that is the one that we have to address urgently.
I'm looking at a letter here from the Canadian Association of Emergency Physicians to ministers of health and premiers, and they're warning in this letter that the health system needs immediate interventions to ensure its survival. That's pretty dramatic language. Is that how you feel? Do you feel like the system is threatened if there's not some sort of help from the province or the federal government?
Definitely, because what we're seeing on the ground is teams being stretched thin, teams losing their, experienced personnel, because the work conditions are really tough. And we're seeing, patient care suffer as a result. And we've seen throughout the country and in Quebec recently, cases of people, not getting access fast enough to emergency and to hospital care, and having, terrible events occurring because of that. So this needs to be addressed, but it cannot just be addressed, to target the ER. It's the whole system that has to reinvent itself in order to care for the population and in the years to come.
Yeah, I know you're not an oncologist, but I'll just tell you these numbers. We know in Quebec more than 4,000 oncology patients have been waiting for their operations. More than 600 of them have been waiting nearly 2 months to get life-saving care. Are we at a place now where people are quite literally dying because they can't access care?
Probably, and again, when we see that healthcare resources are so scarce, and there are delays in care, and patients suffer as a result, and the literature tells us that as well. So and one of the things is that we're pushing towards more efficiency, using the hospital, in a smarter way, and try to work on outpatient care clinics and outpatient care in general. And this will benefit all the other healthcare sectors, like oncology, like surgery, not just the ER. ER is kind of the tip of the iceberg, and where we see the overflow happening, but all the areas of healthcare are suffering.
The federal government announced earlier this year a $2 billion infusion into the Canada Health Transfer, and they said it was to address wait times, surgical backlogs from COVID. Have you seen that money trickle through the system? Has it helped at all?
It's always tough to follow the trail of money like that. We sure hope it will trickle down, and we sure hope that we're going to be able to measure the effect of those incentives, because we do need the help. We do need more capacity. We do need more personnel, qualified personnel, to work to better the care of Canadians and Quebecers.
What do you need from the Quebec government?
Well, the first thing I think is being done is acknowledging that there is a huge problem and it needs to be dealt with, faster than later. And I think we need to look. There's data out there. There's other places that have put measures in place. Other countries. We need to look at what's being done elsewhere and what has worked elsewhere. What is working in some areas. Some hospitals fare better than other hospitals. So we need to sit down, and they need to sit down and take a look at what has worked and implemented throughout the healthcare network. And also we need to increase our capacity within our walls of the hospitals.
So if capacity isn't increased, if some of the work you're talking about isn't done and done quickly, what are we looking at? Are we looking at the collapse of the healthcare system?
Well, we're looking at hindered quality of care for patients, that's for sure, and longer delays and more stress on healthcare personnel. And what we fear is also losing the precious members of our team that will just be fed up with the constant pressure that they bear in their daily work.
Okay, let's leave it there. Thank you so much to Dr. Judy Morris, the president of the Association of Emergency Physicians of Quebec. Thank you.
Thanks.